We're having a pretty good day today. He's not medicated, but that's because I'm, I'm kind of learning how to adjust his drugs. So yesterday he's in a lot of pain in his hip, the hip where he doesn't have, or the buttocks where he doesn't have a hip joint anymore is turning to bone. It's called hypertrophic ossification, and it was supposed to have stopped. The process was supposed to stop after about 6 months or a year, but it hasn't. So he's got a partially bony butt, literally, and it's causing all the muscles around it to spasm. So yesterday, he takes a muscle relaxer called Klonopin, which is a really long-acting, they're called benzodiazepines. That's what like Ativan and all that stuff is. So I gave him one of those in the afternoon like I was supposed to, and he was pretty good, and he slept some, and he wasn't too rambunctious. And then last night he took another one. So since he had, that's what I gave him for sleep. So since he had a whole bunch of that stuff in him yesterday, it has some residual effect, and I think the Klonopin actually turns into a number of metabolites, and one of them is Valium. So it tends to last a long time. So he's getting the benefits now of the muscle relaxing without running around, like a drunken fool, which happened for a while last night. You know, you try to keep him nicely balanced and stuff, but sometimes it just, about once a week he'll get a little too much, and it's like being around a drunk. It's really obnoxious, and so I do everything I can to avoid over-medicating him. But when he's really, really in pain, I mean, I've got a rule where I don't do anything for my benefit, so I would never give him like a pill because I needed, some downtime. But sometimes I would like to. So anyway, we're having a good Sunday because he's not heavily medicated today. He's getting that residual effect, and he probably waited too long to take a pain pill because he just won't do it right. I mean, I don't know if this is stubbornness or he just doesn't understand. After being lectured by me, the doctor, my sister who's a hospice nurse, the rule is you anticipate the pain and you take the pain medicine to disrupt it before it gets too bad. Once the pain is full blown, it's really hard to get rid of, and it takes a lot more drugs. So if you can anticipate the pain and know about what time of day it's going to occur, or what the signs are that that you're going to have a very painful day, I guess the dementia stuff, you just can't plan ahead like that. So a lot of these drugs, he gets a regular dose of the pain medicine that's time released, so he takes those at the same time every day. But then they also have what they call the breakout medicine, or breakthrough, or the optional pills, the fast-acting pain pills that you can take for, I forget if they call it breakthrough pain or breakout pain. I always call it the wrong thing, and I can't remember which one. I think it's breakthrough. So anyway, that's what the patients have trouble with when they reach a certain point. So it's up to the caregiver to kind of know what things trigger pain and to anticipate it, and to try to get the medicine in them, before the huge pain starts. And then if the huge pain starts, then that's when you have to give more medicine, and then that's when you end up with the patient getting over-medicated and acting like a drunken fool, which is really a drag. So anyway, I'm back up on the hill for a few minutes. I got about 5 minutes left, and I'm going to dig up some amaryllis bulbs that have been languishing for the last couple of years because I haven't been taking care of them. So that'll be fun.